So in this video, we're showing a passive knee flexion motion using our R2000 robot with our musculoskeletal knee simulator. The purpose of this robot is to be able to simulate normal knee motion from 0 to 120 degrees of knee flexion. So as the knee is flexed, it's clearly not a hinge joint, so you can't just move the femur relative to the tibia in a perfect straight line. You have to have some sort of actuation platform underneath it to move and normalize all the forces as the knee is being flexed, because we are dealing with varus valgus rotation, internal external rotation, as well as some anterior posterior tibial slide, even some medial lateral translation as well. So the purpose of the robot is to move as the knee is being flexed and normalize all the forces. So the cool thing about this robot, not only is it very new for this time period, it's also very versatile. We can do a lot of things with it. We can exert forces to 1 kilonewton in any direction, as well as torques and moments of up to 10 newton meters along any axis. So say we want to study the strain on the ACL at 90 degrees of flexion with 100 newtons of anterior draw, we can do that with this robot. So this robot is very versatile, and we can study almost anything as far as range of motion goes from 0 to 120 degrees of knee flexion. Along with the robot, we also have a lot of different measurement techniques and measurement devices. We have a microstrain sensor, which we can place on a ligament or a tendon. We can measure the strain of the ligament or tendon as the knee is being flexed. We have a Polaris motion capture system, so we can use 3D visualization with passive motion markers to track how the knee is moving. So we can put markers on the femur, the tibia, and track how the knee is moving relative to each other. Along with those two, we also have a Tekscan pressure sensor system that we can place in between two hard surfaces to measure the pressure contact forces, such as the patellofemoral force or the force between the tibial and the femoral condyles. So along with all these measurement devices, in combination with the robot, we have a very powerful way to study knee biomechanics in vivo. Other than that, along with this robot that you're seeing in this video, we also have a Denso robot in this same lab, which is a 6-degree of freedom robot that's capable of moving in a pretty constrained workspace, but combining the Denso robot with a Polaris motion capture system, we're able to do program in vivo, or program new surgical techniques. We can use that Denso robot to develop new surgical techniques for different types of surgeries. For example, there's one on the scaphoid of the hand where we can position the Denso robot in using a drill guide to the appropriate location on the scaphoid to actually drill a fixation screw through the scaphoid in the appropriate direction. So things like that are done with the Denso, and